Now we go to Lisa Schrening from CIDREP News. Lisa?
Thanks for taking my question. I am just wondering what the situation is in the Middle East. It seems like cases are steadily going up there, and we track that every day, and seems just wondering how you would characterize that. I understand every country has a different situation, but it would be good to get your comments on that. Thanks so much.
Yeah, I can begin on that. The DG may wish to add. There are a number of different dynamics in the Middle East, and the numbers have been relatively stable in the Middle East, but there have been some increases in the Gulf countries. But worryingly, we've seen, for example, increases in cases in places like Yemen. We've seen the introduction of disease into camp and displaced populations in places like Iraq. We've had at least one case in a refugee camp. So, and also we've had cases in Syria. The difficulty in many of the Middle Eastern countries, and there's a huge contrast in the Middle East between countries that are relatively wealthy and well provisioned in terms of healthcare, and then countries in which we have huge conflict, fragility and vulnerability. And the situation, the risks and the potential impact of this disease is very different in all. It is exceptionally difficult to run essential health services in many countries, particularly in the likes of Yemen, Syria and Iraq. The UN is working with governments and partners for years now to try and to sustain those essential services. It is all the more difficult then to respond effectively to the arrival of the disease in many of these situations. Many of the countries are fractured with different zones of control and different health authorities, so often in conflict. And WHO and its partners have to work across lines, across front lines, work cross-border, and it's a very, very dynamic situation. It's a very sensitive situation, and one in which we have to try our best to serve those who are most vulnerable. If we take the case of Yemen, there's a very worrying situation emerging in terms of the number of cases in both the north and the south. And WHO has been working very, very hard in Yemen, despite these difficulties, with our UN partners, where we've repurposed 26 EOCs across the country, 10 operational in the south, 13 in the north. We've established with the government 4 COVID hotlines. We've repurposed 300 rapid response teams, which were trained for cholera. We need about 1,000 of those teams with 2 to 5 staff per team. These are the contact tracing teams, the teams that go out and look for cases and do that public health work we're always talking about. Most of these teams are mobile. These are 202 district mobile teams in the north, 131 in the south. We've already begun rapid response trainings and clinical management training with a large number of clinicians, nurses and doctors, and established screening at points of entry. We've supported the repurposing of 4 functional central public health labs in Aden, Sana, Sayum and Taiz. We've trained 28 lab technicians in the diagnosis using these rapid and PCR-based tests. We've deployed over 7,000 tests, 3,500 in the north, 3,200 in the south, and we have another 30,000 on the way. We created 19 isolation units, 16 are in progress, 3 are completed, and we've trained 92 frontline workers to staff those units so far. That list goes on. In terms of operational support, we've provided 1,000 ICU beds, 417 ventilators, and then, as I said, another 50,000 tests are in the pipeline. We're refilling nearly 12,000 cylinders of oxygen per month. distributing defibrillators, ECG machines, IV pumps, pulse oximeters, and many other things. Now, that sounds like a very long list, and it is a long list, but I can assure you, moving that type of material in this situation, training health workers in this situation, doing surveillance in this situation, contact tracing in this situation, is difficult, stressful, and dangerous work. And the DG has called for it, the Secretary General has called for it. We need health for peace, we need peace for health. It is going to be very difficult to contain this virus in settings like this, having to operate in conditions like this, unless we get a more peaceful environment to do this. Again, Tedros has said no one is safe until everyone is safe. We need to make the people of the Middle East, particularly those in fragile and conflict-affected situations, safer, because that will make everybody safer. We're also working across a number of Gulf countries on issues related to migrant workers, and Maria may wish to comment on that. We are concerned about migrant workers who live mainly in dormitory-like situations. We've seen the impacts of that in places like Singapore. We thank Singapore, the Gulf countries and South Africa for working with us on this issue. Maria has just finished some discussions with those partner countries today. She may wish to update you.
So to add briefly, yes, another worrying trend in the Middle East are increasing case numbers in dormitories where many expat workers live. And in a number of countries across the Gulf states, a large proportion of the population that live there are not from that country. And so today we had a preliminary teleconference between several countries and our Eastern Mediterranean regional office, as well as some colleagues from Singapore, to exchange and to share experiences, to learn from each other about the outbreaks that are happening in these settings. They're very similar conditions, and the fundamentals of what need to be done in each one of these closed settings are the same. So it was a very good opportunity to be able to exchange and learn from one another, to see how these outbreaks could be brought under control, and so that we could prevent them from further happening. And we hope to have more teleconferences like this. I think one of the things in this pandemic, and in all epidemics, the value of WHO and our partners is to bring people together, so that what they're going through and how they are dealing with it can be shared, and each can learn from each other on that.